Good evening, everyone. Welcome to the Midlands African Chamber's Power Hour Business Development Live series, proudly presented by Google. My name is Fidel Miento. I am the COO at the Midlands African Chamber, and I'll be your host today. It is great to have you join us for another exciting episode where we bring you invaluable resources on trauma, recovery, and brain injury. We are thrilled to have a special guest with us tonight, Heather Carroll, resource facilitator at the Brain Injury Alliance of Nebraska. Heather is here to talk to us about neurodivergence, brain injury awareness, as well as share of resources available in the community. Heather Carroll is a passionate and creative individual who is deeply committed to her family, church community, and helping others. A retired Air Force Master Sergeant with 22 years of service, Heather worked as a nationally registered emergency medical technician and served in various roles, including deploying to Kuwait in 2007 and leading a team in the contingency aeromedical staging facility. She also toured with the Tops in Blues performance team representing the Air Force finest entertainers. After retiring in 2016, Heather pursued a career in psychology, earning her bachelor's degree with distinction in 2018. She worked at Bellevue University as an evaluation specialist, research analyst, and manager of the Military Veterans Services Center, where she helped veterans access crucial resources for their service-connected disabilities. Heather is currently pursuing her master's in mental health clinical counseling with a focus on supporting veterans and individuals with trauma. In addition to her educational pursuits, Heather is active in her church where she teaches Sunday school, serves as a care pastor, and performs in the worship team. With over 30 years of experience in medical service and resource facilitation, Heather is now excited to serve as part of the Brain Injury Alliance of Nebraska, helping individuals with brain injuries and educating the community about available resources. Today, Heather will share her expertise about neurodivergence and brain injury awareness, as well as share resources with us. Without any further ado, please join me in welcoming Heather Carroll. Heather, thank you for being with us today.
Yes, thank you so much for having me. It's such a pleasure to be here.
Definitely. Fantastic. We don't want to waste any more time, so we'll dive right in. Heather will now share her presentation on neurodivergence. You have 40 minutes.
Thank you so much.
You're welcome.
What a beautiful introduction. Thank you so much. Like Fidel said, I am a resource facilitator with the Brain Injury Alliance. One of the biggest things that I would desire if you took anything away from this presentation this evening is to start seeing brain injury from the lens of, is it a won't or a can't? A lot of times persons with brain injury are going to look lazy. They may look defiant. They may look kind of scattered and not able to stay on task very easily. And you may even see a lot of impulsivity type behaviors. So what is a brain injury? A lot of people are very, very familiar with, the traumatic brain injury, which is caused by the bump, the blow, or the jolt to the head. Sometimes we also see the brain injury with those penetrating injuries that will disrupt the normal functioning of the brain. But there's also acquired brain injury. And those are the types of injuries that we don't always stop and think about. These are the ones that are after birth, they're hereditary, they're congenital or degenerative, and oftentimes they typically occur after the birth. So we'll see things like brain tumors, those anoxic, hypoxic due to strangulations in domestic violence, perhaps overdoses of opioids, near drownings. We've even seen some affiliation with long COVID, also like aneurysms, toxic ingestions, toxic substances like carbon monoxide poisoning are all modalities of brain injury. So there's a little video here, and as you can see, the amount of force on the brain when we're talking about how much force it takes to cause a brain injury, this is it right here. It doesn't take much, right? And so what happens is the brain kind of sloshes around inside of the head, and we get things that's called tracking. And typically you're not going to find a specific diagnoses of brain injury until after death, where they actually see those tracks in the brain. Those bony prominences inside of our skull is what rubs up against the brain during that impact, as you're seeing here in this video. So when we're talking about strangulation and overdosing on opioids, we're finding out a lot more information. And so as we update the fingerprint of brain injury and that hypoxic and ischemic damage from the lack of oxygenation to the brain, we see it a lot in overdosing of opioids, and how it's if somebody stops breathing even for 5 minutes or greater, it's the denying the brain of the oxygenation, which then affects the function of the brain as well. So the no oxygen to the brain is what is that anoxic brain injury. And if there's reduced oxygen to the brain, then we call that a hypoxic brain damage. It is cell death, and it begins in the brain after only 5 minutes of oxygen deprivation. And then it directly impacts the executive functions, particularly things like self-regulation, which are very similar to the traumatic brain injury, but still are set apart a bit. Our director, or our CEO of the Brain Injury Alliance, would tell you a story of when she worked at Madonna as a social worker for years. She had 2 clients, one which had a traumatic brain injury and one which had the anoxic brain injury. And the amount of resources and coordination required of the person with that hypoxic anoxic injury was a little bit more vast and greater than the individual with the traumatic brain injury. So let's kind of get into those basic effects of brain injury. What kind of manifestation will you see? What kind of signs and symptoms will you be looking for with somebody with brain injury? So they're going to have balance and walking problems. They might feel a little bit dizzy right afterwards, headaches, fatigue, sleep disturbances, nausea and vomiting. Ringing in the ears is a very common after effect of brain injury as well, which a lot of people don't know is associated with brain injury. Those disorders of taste and smell can also be very common with brain injury. And then that sensitivity to light and those migraines that kind of manifest for individuals. And then oftentimes there's a lot of visual disturbances. Many people with brain injury don't realize or understand the visual disturbances that are happening, because our brain is so capable of kind of modifying and making up for that disparity. So they won't even realize that they're walking around objects, but the rest of us will see that they're walking around an object that may not even be spatially close to them. So that's what we kind of see with those visual disturbances. Some of the vision facts associated with brain injury is that those with traumatic brain injury are 90% of those experiencing brain injury experience one or more visual dysfunctions after their injury. 40% of those TBI patients will have visual dysfunctions that will last more than 3 months. And 53% have symptoms that last beyond the 12-month time frame. And 70% of our brain is dedicated to vision. That's a lot of that brain that we saw earlier sloshing around. 70% of that is dedicated to to vision and spatiality. So, and then 80% of all of our sensory function actually goes through our eyes. So it's got to pass through our eyes before it hits our brain. So those are really high numbers. So when we're talking about visual disturbances after brain injury, it can be very significant to the individual. We also see cognitive effects of brain injury. These are things where people aren't necessarily going to be able to pay attention for long periods of time. They might have memory where they're searching for words and they can't get them out. They might even feel kind of foggy or even slow thinking. You might kind of see them staring off into the distance during conversations. And then they oftentimes have learning and memory problems as well. Some of those executive function issues are like processing problems. They won't be able to plan. They have insight and awareness issues. They may not be aware of their surroundings or have insight on how to proceed or process. within your team at work. And then they oftentimes have issues with sequencing as well. And again, when we talk about these effects of brain injury, some of these injuries will be short term and some of them will be longer. And we'll get into that just a little bit later. So we also have the social and emotional effects of brain injury. And I love all these faces on this screen because it really describes how often the person with brain injury can really just be all over the place. They might have like a synergistic issue of a lot of these things manifesting. And again, not everybody has all of these signs and symptoms that you're seeing here, but some of them might have some and others may have others. And so one of the main lines we talk about in the brain injury community is if you've seen one brain injury, you've only seen one brain injury. These things look different in each individual, which also makes it kind of hard for diagnoses as well. So we learned about all these signs and symptoms. So what is the course of recovery for individuals with brain injury? You can see here that many of the domains will resolve at different rates. So cognition may take longer than other symptoms, and other symptoms, may be lesser. It's different with every individual. But in general, the majority of mild injuries will typically recover within the first 3 to 4 weeks. However, more of the severe and moderate injuries, which is about 10 to 20% of the mild, will require a little bit more time and a little bit more effort and work. And then when we start looking at injury upon injury upon injury, we see that it has this cumulative effect on individuals, and a lot of these recovery times are longer, if at all. So our mild injuries, on severity, about 80% of our population we find are in this category with the mild injuries, where oftentimes there's no loss of consciousness with these individuals, or they may have had a loss of consciousness with the 5 to 30 minute time frame. They might have a little bit of post amnesia during their first hour, but then it comes back fairly quickly after that. And sometimes these may not show up for days or hours afterwards. And most of these injuries, they're not visible on a CT scan or an MRI. And over 90% go unreported. A lot of people get that minor concussion. They bump their head. They slip on the ice. They might get thrown up against a wall during a domestic violence situation, and they don't seek care. They don't report it. And oftentimes, even if individuals go to the emergency room, they send them home with concussion protocols, right? Just make sure you watch them, make sure they don't pass out, make sure that they're breathing. You might get headaches, you might be sensitive to light. And then what, right? There's nothing to follow after that unless we start connecting individuals to these valid resources in the community. And that's where the Brain Injury Alliance kind of steps in and helps out. The moderate injuries are about 10% of all injuries that are reported. And the loss of consciousness in this range is anywhere from 30 minutes to 24 hours. The post amnesia is somewhere between 1 and 24 hours it may manifest. And then typically they're going to get immediate care and they're going to need urgent care. And you're going to notice these signs and symptoms immediately. So when you see the bleeding of the head and the crushing of the skulls and those types of injuries, you're going to start seeing those signs and symptoms that we talked about earlier almost immediately. The severe brain injuries are about 10% of the population that's reported. And this is typically any loss of consciousness greater than 24 hours. And then again, you're going to notice these things immediately, and they are also going to need emergent care. So in the state of Nebraska, with the Nebraska Brain Injury Registry, we are lucky enough to have that within our facility. So if somebody does go to the emergency room, these cases are getting reported. On average, 13,850 of these cases are reported annually each year. But these numbers are just from hospital discharges. So if they didn't seek attention or they didn't seek medical care, those numbers aren't getting reported. So you can see that there's a vast discrepancy between those being reported and those actually being taken care of. Here's a couple of interesting comparisons within the United States here. When we start looking at the U.S. cases annually, it's at about 400,000. These compare to multiple sclerosis, spinal cord injury, HIV, breast cancer, and diagnoses. Oh, I'm sorry about that. Diagnoses combined. In the U.S., TBIs annually from the emergency department visits and hospitalizations for traumatic brain injury come to about 2.8 million. You can see the breakdown a little bit further that 10,000 of those are multiple sclerosis, 18,000 is the spinal cord injury, HIV is 31,000, breast cancer is 342, and the traumatic brain injury is an alarming 2.8. So one of the things that we really take a look at within the brain injury world is those populations that are at a higher risk. So in general, the general public is usually about 8.5% of brain injuries. Veterans are about 20% of all reported brain injuries. Those imprisoned are up to 85%, which you can see that's a huge number. Those victims of domestic violence that are reported here in Nebraska is about 58% of brain injuries. And those in youth, in juvenile, and in juvenile detention are anywhere from 32% to 72%. And you can see this large disparity in that number, and that there's such a huge gap. And that's because so many are underreported. These kids are getting in fights, banging their heads, and they're in these sports, and not all of these concussions and brain injuries are being reported and dealt with medically. And then, of course, those in mental health programs, they take up about 77% of the Nebraska data. So when we talk about all of the different modalities of brain injury, it's very synergistic. And I don't know why it's advancing on me. It's playing a game, I guess. But you can see this is a mess, and it kind of is all overlapping. So when we look at brain injury compared to anxiety and PTSD and other mental health conditions, substance use, those environmental stressors, even those pre-existing disabilities, like perhaps seizures or epilepsy, and then even interpersonal issues. So as we start adding all of these things together, they just really overlap with the signs and symptoms. And if you were to go in and take a look at a lot of the signs and symptoms of these other issues, you can see that a lot of them overlap. And that's what you're seeing here as the synergy or the synergistic intervention of it. So behavioral health and traumatic brain injury, about 28% of persons with brain injury or suicidal thoughts have suicide attempts, and 17% of those are attempts, and 28% are the thoughts of suicide after brain injury. And this is compared to 4% in the general public. So you can see that disparity between a person without brain injury and a person with brain injury. As far as substance use, a lot of individuals, our general population is sitting at 7%, and those with brain injury are 48% for either alcohol or drug, 29% just opioids, drugs, things of that nature, and 43% are likely to use alcohol or abuse it. And when we look at the mental health numbers, 30% of brain injury survivors are experiencing other mental health symptoms and concerns after injury. And 85% of families report that the person with brain injury does, in fact, have behavioral changes. And so that's where we really see this overlap. Is it behavioral health? Is it brain injury? Which is it, right? So moving on to recognizing what a TBI is and how critical it is for improving mental health. A lot of our mental health providers, this is why we get out there and we do these presentations and we want to educate the population, is because a lot of people overlook the signs and symptoms of brain injury when they're dealing with mental health. But in order to address mental health effectively, we must also look at the treatment efforts for traumatic brain injury as well. And it is very complicated, and it is layering as well. So recognizing TBI, we must look at the traditional interventions, and we may need additional considerations as well. So that's when we start bringing in and making that tribe or that team for the individual with brain injury, and we start working and referring the individuals out to the different modalities within the community. So it might be a physiatrist, and we'll kind of go over the diagnosis in that a little bit later. We also look at the psychopharmacological. We're not individuals in the Brain Injury Alliance who do the diagnosis part. We don't do the psychotherapy. We don't do anything with medications. But what we really need to do is get them to individuals who do understand brain injury and are paying attention to the brain injury aspect of the mental health as well. So that's why it is so important to look at it all encompassing rather than brain injury separate from. If you were to look in the DSM-5 in which, mental health therapists and psychologists utilize, you will see that brain injury just has this tiny little tidbit, and it goes right into that neurocognitive disorder. And that's really what we're looking at is why is the brain not functioning like it used to? And that's when we start drilling down and taking a look at the signs and symptoms. So this is kind of really impactful. It's so important that a person with brain injury doesn't use alcohol and substances. And these are newer things that we're discovering as well, and how they're impacting and slowing that rate due to the neuron disruption. So the substance use impacts recovery of the brain itself. The BI and substance use affect their balance, their walking, and their talking. So they're already having issues with balance and coordination. Now we're adding that substance in, and it's making it far greater and worse. Also, it's going to affect their impulse control. They're already having issues with the ability to keep their anger at bay. This will just magnify that. And then as far as executive functioning, it's going to also inhibit and make that executive functioning a lot more difficult for the person with brain injury. It has a very powerful effect on brain injury, and someone might manifest and be more depressed on substance use as well, and it might make that depression far greater and worse. It also increases the chances of seizures. We do see that persons with brain injury can and will and have developed seizures post brain injury, and this will just amplify that again. And then these seizures will also increase the probability of brain injury, as they're having that seizure, that brain is sloshing around again inside of the head, causing more injury. So this is where we really talk about that won't versus can't. And one of the most powerful things about brain injury is making sure we give that education, not only to the person with brain injury, but to family members and the community in which they're living in, schools, work, the whole 9 yards. The screening process might be the very first time that they ever identify or even understand anything about brain injury. And then the message that we really want to get out there is people are not broken, and that there are ways to compensate for the deficits that they are experiencing with their brain injury. And that the person, they may not even be able to recognize their own deficits. A lot of times you're going to find the person with brain injury in that pre-contemplative stage of change where they don't recognize the problem. They don't know that they have an issue or problem, which makes the conversation a lot more harder for that individual as well, which is why we get into the screening process. We use the Ohio State University Modified Brain Injury Screening Tool. This is what this screening tool looks like. I know it kind of looks scary at first, but it's really, you go through one through 6 on the front page. And then that second section, that's step 1, we write down what the cause of that injury is. We associate the item question, and then we identify if there was a loss of consciousness, were they knocked out, was there a dazed or memory gap, and at what age did that happen? Now, age really plays a role into this, so we can kind of see when did this start and when is the most recent date of injury. So we can take a look at when we talk about injury on the next side on step 3, we really ask about, hey, what has happened in the last, in a 6-month time frame? a lot of times we'll see this in domestic violence with strangulations and blows to the head and pushing or dragging downstairs. We'll see that they had an injury starting at maybe 5 or 6 years old, and their last injury may have been when they were 47 years old. The one being, at 47, we might even see multiple of blows to the head in that 6-month period, which actually adds more deficit, more seriousness to that brain injury, which also increases that length of symptomology as well. So again, when we go back to, if you've seen a brain injury, you've only seen one brain injury. We also then ask in step 4. So as you can see, in step 3, we go ahead and we talk about what are those caused and repeated blows of injury, and what does that look like? Is there the memory gap? Is there the loss of consciousness? Last but not least, in step 4, we will go through and ask about unmanaged or untreated epilepsy or seizures, stroke, cerebral vascular disease, transient ischemic attacks, tumor of the brain, swelling of the brain, toxic effects of poisoning such as carbon monoxide, even the long COVID has been added, infections like meningitis, encephalitis, those actually impact the brain as well. And then the brain bleed or the hemorrhage that we'll oftentimes see. So bottom line is we don't do the diagnostic, but this is a great tool that we sit down with our client. We get all of their history in one location. This tool then becomes a conversational piece when they go to the doctor's office. It becomes a conversational piece that can be added to their record. It becomes a device where all of their history is in one place. Most oftentimes, people don't remember how many times they've had that bump or blow to the head. I can tell you, I've been with the Brain Injury Alliance in Nebraska since December of last year. And more times where I stopped and I realized, I was like, oh yeah, that time that I fell off, the cheerleading pyramid, and I put my head got hit and my teeth went through the front of my lips. That was a definite brain injury. And when I was doing the back handspring and I got dropped on my head, those types of things. When I fell over my bike, I got up and I kept on going, even though my helmet was cracked all the way through. I got up and I kept going. We don't stop. We rub dirt on it and keep going, right? That's this mentality that we've always had, but it is serious. And those repeated blows and the prolonged blows really can leave an impact years later. I'll tell you, on certain days, I'll sit here and the light that comes through the window will just not sit with me right, and my migraines will come back, or my ears will start ringing just out of the blue. And I consider myself fully functioning and capable, but there are certain days where I get some brain fog and I might be dizzy and I may not feel so hot. So one of the other things that we love to do is the symptoms questionnaire. This is a wonderful way of looking at the different concerns of the person with brain injury. When we talked about all of those symptoms before, this is where we get to take a look at how much does this bother that particular individual on any given day. Is it, I'm extremely bothered? Am I moderately bothered by it? Am I mildly bothered? And we go through these series of questions, and these series of questions, as you can see, are addressing those memory concerns, the delayed processing, the attention, the inhibition, the physical and the sensory or motor issues, the language, being able to search or not search for those words, the organization abilities of the individual, the mental flexibility, and the emotional. These things are important because this is, we start working with the actual effects that it's having on the individual on their daily living. Some people are more affected than others. We also offer this as an online tool. This is something where you can point and shoot at the QR code. It's important that when you self-administer this and you take a look at it, to know that you're going to get tip sheets on the other side of this. And these tip sheets come out based off of the memory and all of those other modalities that we talked about. And then this is how you can put it into practice, and you can bring it to the different individuals and say, hey, mom, dad, or talk with your kid about it and really start meeting them where they're at, in that they can't instead of they won't. And you start to see a lot of behavioral changes. I have so many clients where we just take the time to get to know the client. what bothers them, and then we go through what we call the working with an individual with brain injury. And I did send this sheet out earlier. I hope we can disperse it out, but on the back, on the front of the sheet, it tells us a guide to working with individuals with brain injury. It tells you what it is, the different modalities, and then you flip to the back, right? And as we looked at that symptoms questionnaire and those different memory concerns, you can see here that if an individual is having a speed of information processing issue, this is the problem that might arise. They might take longer to complete a task. They might be unable to keep track of lengthy conversations. And management strategies that you as a loved one or a boss at work can do is you can make allowances and give that person extra time. You can present only one thing at a time, knowing that, okay, if I ask them to do two things at once, that other thing always gets forgotten, but they are capable of getting the task done. And sometimes, depending on the level of injury, you might have to go step by step and even write these things down for them. But what's beautiful about this worksheet, and it's by far my favorite, I will sit down with my clients, we will highlight the areas, and then they will take this to the attorney so that the attorney knows how to talk with them. We are getting out there and talking with judges and other attorneys in the community to let them know that, hey, if you're seeing these things in individuals, these people look like you and I. You can't see brain injury, right? It's all inside. And their testimony and what they tell you is critical and important so that you can start looking at how can I help them be successful right where they're at. Some other issues are communication, planning and organizing, reasoning, and self-monitoring. And again, you're seeing all of these strategies that you can use to help manage with that individual. So we don't do the diagnosis on our end, but it is really important to get diagnoses taken care of for these individuals. So if somebody comes to us in resource facilitation at the Brain Injury Alliance, we're going to talk to them. We're going to meet them. We're going to find out what's going on. We're going to get to the nuts and bolts of things, and then we're going to get them out. We're going to get them referred if they don't already have a diagnosis. We want to know how the injury happened, the area of the injury with the degree of force, because the area determines like what area they're going to have a problem with on those executive functionings as well. Were the loss of consciousness, days, and confusion, that is super important. How long they were out is super important because that tells us that deoxygenation phase. And then any changes in the behavior, awareness, speech, or coordination. And I'll tell you, I had a really good friend shortly after starting to work with the Brain Injury Alliance, whose son was in a motor vehicle accident. And about 4 weeks later, we were sitting down at dinner and he was just telling me all of these things that are going on about his headache, and he can't think straight, and he can't function, and something's just off, right? I just know I'm not the same that I used to be. And that's where I was like, look, let's open a case. Let's get you over to Madonna. Let's get you seen. So it starts with that primary care provider, as you see here, and they get that referral out. And then one of my favorite people to refer to is physiatrists, because the physiatrists, they're going to specialize in that rehabilitation medicine and that spasticity, and they're going to take care of the pain. Now, a lot of people would think, oh, neurology is the way to go. Yes, neurologists are super important and part of this big part of functioning, but they're really looking at the structure and function of the brain, and they're diagnosing disease. They're not looking specifically for the brain injury itself and those behavioral changes. So all of these, physiatry, neuropsychologists, physical therapists, occupational therapists, speech language pathologists, audiology, psychology, and neurology are all part of the brain injury world. And some clients will need all of them. Some clients will need some, and some clients may not even need a referral, and they just got those minor issues going on. So this is who we are. We're the Brain Injury, and it's actually association. We just did a name change. We just have not had a chance to get all of our slide decks taken care of quite yet. But this is who we are. This is how to get a hold of us. We help with brain injury education and counseling. We identify the communities and the resources, and we facilitate those applications and connections to those resources. And these are a couple other resources that you can take a look at. Obviously, biane.org. You can take a look at who we are, our team. We've got a team across the state of Nebraska, all the way to the Panhandle, all the way up and down. We cover the entire state. So we're ready and willing and able to get people connected to the resources they so desperately need. We have a huge database. We've got many, many years of experience on the table with our team. And we each kind of have our unique area that we really like to focus on. But if one of us doesn't have specific knowledge in the area you're looking for, we're going to connect you to one of us that does. So we're not going to leave you empty-handed. I'm so grateful and thankful for the time I've had with you today. We really value your feedback. We want to know how we can improve on our presentations. We want to know, did the information make sense to you? So please go and give us the feedback on our presentation for you this evening. And we'd love to know how we can better serve you as well.
Awesome. Thank you so much, Heather, for that very informative presentation. This is such a great topic, to have so many people may be in need of these services. However, they just don't know where to turn. So I'm glad that, you have been able to have the time to just come and talk to us today regarding that neurodivergence and brain injury. Now let's dive right into some questions. If that's okay. All right. So Heather, your journey from the military to psychology and brain injury advocacy is remarkable. How has your career path uniquely positioned you to address brain injury awareness, especially for underserved communities?
I personally believe, I've just always been set on a very specific path. And as life has happened and occurred, I have learned much resiliency. Much resiliency. I have been a survivor of domestic violence as well, and intimate partner violence. And so that adds to my abilities and my awareness and my knowledge of brain injury. But being a medical technician for 22 years in the Air Force and having the exposure of the science behind injury, having the ability to work with different populations has really broadened my cultural opportunity and my multicultural diversity as well. And as I continue in my master's degree program in the mental health clinical counseling, I can see how important it is to really know somebody's story and know their background too, because we might be a little bit more impulsive in areas that we wouldn't think so when we come from different backgrounds. And our family and our upbringings is so critical to who we become and who we are. Oftentimes we're seeing kiddos that had been abused at a very young age who have brain injuries present, and we don't stop and realize that. There's, one story that I learned is there was a young man who was in the room next to the raid when the police stormed in. And when they came in with the raid and the sound and the banging, he actually sustained a brain injury from the police coming in and raiding that parent's home. And very unfortunate circumstances and very unfortunate ways in which brain injury occurs. And it's not, brain injury happens to anybody. Brain injury doesn't recognize who or what we are or where we come from. It doesn't care. It's going to happen. And we have to be ready and willing to support these individuals and not call them broken and not call them crazy and not call them messed up, but to know that they're a human being and that they need to be treated as such.
Definitely. Thank you so much, because it's very important to be aware of the situation of the individual that you're also dealing with, and kind of put everything together, treat the whole person, not as a less than or being biased because of, different reasons. But it's good to, really be passionate, I think one of the roles you're in is definitely one of those roles that you have to have passion for humanity in order to be able to help people and address, their needs efficiently. So thank you for doing what you do, because we need more people like you out there in today's world.
Yes, ma'am. Absolutely.
Yeah. Well, can you elaborate on the ways brain injuries disproportionately affect BIPOC and underserved population, and what strategies can be implemented to address these disparities?
I think that access to care is going to be that biggest disparity and in knowledge, right? Because knowledge is so powerful. So getting this information out there, letting individuals know that these resources are there. Our resources are free. Our services are completely free. So we're here to help anybody with brain injury. Even if you just suspect it, we are here, and we want people to know to come to us, right? That we're going to get to you, we're going to help you, we're going to find out what your needs are, and we're going to get you referred out. Like I had already said, brain injury, it doesn't look at a specific person. It just
doesn't discriminate.
What's that?
I said it doesn't
discriminate, right? Absolutely. It's going after whatever, right? And I'm not saying like it comes after you, but these things happen. We need to be aware. We need to use protection. There are programs out there that will help with this. Like even we've got TAC tools for teachers. There's a whole REAP program out there that we've been working on and getting into the school systems to make sure that they know concussion protocols, not returning kids to learn too soon. Those protocols are out there. You'll find those on our website. You can even, seek me out. I can get you those resources as well. If you know somebody that could benefit from this information knowledge, give them our name. We'll come out, we'll do the community education. Again, like access to care is, especially with Medicare and Medicaid and getting there's waivers out there for families with brain injury that can give you better access to care. It's a long wait time. Like it's 120 minutes right now, roughly, just to get through the call to get the initial appointment. So a lot of times we'll sit on the call while we're doing other things, and then we'll call our clients and we'll get on the phone with them, because the person with brain injury, they're too impulsive. They're not going to sit and wait, right? Like they can't, they can't do this. It's not that they don't want to, they just physically cannot make it happen. And so we find ways to make sure to connect them to those resources. Community Alliance is a fantastic one where we connect to a case manager to make sure that somebody is physically there, helping them file the paperwork, getting them through that. There's clients that I have met with where I will help them walk through the process if they don't have anybody else. We do our best to do resource facilitation and not do the heavy lifting, because we do reach so many people, but all of our resource facilitators are completely prepared to help them wherever we can. Like sometimes we move walls. We have to.
Yeah, absolutely. Thank you. It's good to know that there are these resources out there and they are free.
Yes. I'm a passionate resource facilitator about face-to-face. So I like to meet my clients. So if I can find a safe place to meet them in person, I want to know them in person. I love Zoom. It's great, especially when the weather's bad. But I'm a face-to-face kind of person. I want to know you. I want to interact with you so I can see what's going on. You can't always see that in a screen over just 30, 45 minutes. So, when we do initial intakes, sometimes it's an hour, sometimes it's 2 hours, sometimes it's 3 hours. It just really depends on the person. Mm-hmm. So I will typically make that initial call, find out how vast we're looking at, and then I make a second appointment after that. So initially I'll get like kind of demographic type information. Who are you? Where do you live? What's your, that sort of stuff. And then I'll connect with them after that. And we have two different types of cases that we also do. We have an information referral where somebody's calling in, they just want some education and they want to get referred out. And then we close that case. And then we have what's called case management, but it's not the kind of case management you're going to see social workers do. It's the kind of case management where we're going to come alongside the family, the individual. We've got a lot of families that call about the person with brain injury, and we help them as if it's the person with brain injury. That's how passionate our team is to getting this education out and getting the awareness out into the community that we're here and we want to help.
Awesome. That's excellent. There's something that happens when you actually meet people face to face. That connection, it breaks barriers, and it
Yes.
just a lot of things happen. There's so much you can do via Zoom, virtually. But once you're able to meet someone and actually connect with them, what they may not be able to tell you via Zoom, they will tell you in person.
Yes, absolutely. I agree to that.
Yeah, so I am glad that you guys are able to do that. That is awesome. Now, how does the work you do with the Brain Injury Alliance of Nebraska empower marginalized groups to access critical resources and support?
A lot of those resources we've already got contacts with, we've already got relationships with them, so we're able to quickly refer folks out and get them connected. There are long wait times. I mean, you see the numbers of persons with brain injury, and you see the numbers. We already know that DHHS and those systems are already overwhelmed. So a lot of patients, a lot of follow through, a lot of hand holding sometimes too. And I don't mean that in a negative way. I mean it in the best possible way, that a lot of times you hear, I can't do that, or there is a fear of leaving. There's clients that I've had that they won't even leave their house because the last time they did, they got struck by a motor vehicle and now they have this brain injury, right? So they won't even walk to the store for food. Or sometimes they're so fearful because they've been beaten, right? And so they don't leave their homes. They barricade themselves in and they'll order food in instead. So getting there and connecting with that individual and letting them know that you love them and care is essential as well. And then, like I said, we've got those established partnerships already in place and people that we know, so we can sometimes try to find ways to fast track through other barriers that people might have without us.
That's great. Thank you. I'm glad that you have that personality too that is easy for people to connect with, because someone may have resources, but because of their personality or the way they are dealing with people, it may be hard for them to be able to, actually address people's needs or address them in ways that maybe you can even do further because of your personality and the way you're just easily able to connect with others. So thank you for that.
Thank you.
Yeah. My next question to you is, what are some misconceptions small business owners and community leaders might have about brain injury and neurodivergence, and how can they better support affected individuals?
Again, I go back to the can't versus won't. It's as simple as that. Getting individuals educated about brain injury, to recognize those signs and symptoms, to ask sometimes the hard questions. And, hey, is there something that you're struggling with or dealing with medically? Or, do you think you might have brain injury? Have you had a brain injury before? Have you, if you know somebody's been in an accident recently, really just kind of taking the time to understand that they probably really, really want to do what you're asking them to do. Their cognitive functioning will not allow them to. There is an interruption of that pathway, of that neuron, right? It's broken, it's severed, it's whatever it might be. That connection isn't there. And so it takes the diagnosis and it takes the rehabilitative process to reconnect that pathway for the brain. So having the patience, having the understanding that, okay, this might be brain injury, and taking a look at that truth and not judging them, right? Because they look lazy or they look sporadic, or maybe they look non-compliant, or maybe they even appear to go against your will or be defiant. That's not oftentimes the case. We need to just look a little bit deeper and ask the questions and get to know your people, right? Like, so oftentimes people come to work, they go home, and they don't want to have anything to do with one another. But if you know your people and you know your team, you're going to know what's going on with their life and know that there's a possibility of brain injury there. And then get them referred out, get them connected to the resources, and have that hard conversation with them.
Yeah, that's the key word. Have that hard conversation. Most people are not able to have difficult conversations, especially in the workplace.
Yes.
And that's one thing. I feel like that's one of my strengths because I can easily read people. You can fool a lot of people, but you cannot fool me because I can pick up on people's energy. So just being able to pick up on those things, because sometimes you can see someone and they are trying so hard to just keep calm and keep everything so that you don't notice anything. But if I see you every day and I work with you every day, I know how you normally are. So if something is off, I will know. Now, whether you want to discuss it or not is entirely up to you.
That's absolutely true. Yes. Yes. Do they feel comfortable?
Yes.
Do they feel connected enough? You know, the other thing, you're gonna see marked changes in the person when they come back from an injury, right? You're gonna see those changes. You're gonna know that something's not right and off. One of the best things you can do is be patient. Don't try and finish the sentences and fill in the words. Let them do it for themselves. Let them know, you know what, it's okay. I know that word's gonna come to you eventually, because it will. And they're going to word search, right? And you're going to see them doing those things, but just give them the time and patience that they deserve.
Compassion. Yes.
Compassion and empathy. Absolutely.
Yes. Thank you for, just sharing that. Now, we have about 10 more minutes here before we are done. I will just ask you maybe one more question before we wrap up. From your experience, how can understanding brain injury improve diversity, equity, and inclusion efforts within organizations and communities?
I'm just going to give a personal note, because before I started working with the Brain Injury Alliance in Nebraska, I hadn't considered that my daughter had a brain injury. Knowing that she did, right? She got beat up. She got her nose put in. She had to have her nose fixed and realigned. And it was her surgeon that said, hey, has she had a brain injury before? And I was like, oh my God, yes, she did. So having the knowledge and having the understanding really shows change. So many people get this information and realize that we're out there. They look at our resources. They start telling us, I don't feel so crazy anymore. I feel validated. I feel heard. I feel understood. And if you can make somebody feel heard and understood in the community, show a little bit of patience, get educated. Like, we have so many resources to educate individuals, or just come and have a conversation with us too. Ask us out to have, a presentation or an interpersonal experience. We would be happy to show people how to use the OSU tool to make them comfortable with that. So if you're like in a medical field, or you're in a mental health field, we go to Heartland Family Services. Just last week, we did a huge presentation. We've got a pilot program going on with domestic violence where they're filling out these OSUs and then they're making referrals over to us, and we're taking it from there. So you can be part of that change. You can send somebody this link for the OBIS, right? So the OBIS is the online brain injury signs and symptoms platform, right? That you go in, you can do the OSU and you can do the symptoms questionnaire. You're going to get an email back from NASHIA, which is our national platform for brain injury. And you're going to get those tip sheets. You can start integrating them. You can share them with individuals. And then you're going to get sent over to us automatically. We're going to reach out and call you and say, how can we help? You might be like, you know what? This is good enough for now. We'll leave you alone and you'll come back to us when you need us. We aren't going to hound people that don't desire or want the information, but we are most certainly here to educate and connect. So that's the key, is making those connections.
And you've just answered my next question, because I was going to ask you, many individuals with brain injury or neurodivergence face challenges in the workplace. What advice would you give to those employers, looking to create a more inclusive environment for those individuals? And you just said it, just being able to bring people, like, share the resources and bring in individuals like you to come and make those presentations so that people can get the help that they need.
And be sensitive too. Like, a lot of agencies and companies are going to have disability services. And yes, brain injury can be considered a disability. There are many, many individuals that we are able to connect to Social Security to get disability for them because they can't thrive in the workplace. Some individuals with brain injury just cannot work anymore. And that is a hard, cold truth for them. And you'll see these individuals jumping from job to job to job. Don't judge them too quickly either, right? Get to the bottom of the why. Like, there's a reason people behave the way that they do. Oftentimes, you're going to see when somebody gets a brain injury, all of those symptoms, all of those behaviors are amplified. So they may have been there underlying, and now they can't hide them anymore, right? Because they're amplified and they're on display, and we will see it before the individual sees it. Most oftentimes, family members will see it first as well. So just again, like we've already dug that nail in, right? Like, just be aware and connect people and network.
Thank you so much, Heather. That was very interesting. And thank you for just sharing your insights with us today. We really appreciate it. I know everybody's busy on the go. There's so much to do, but I appreciate you taking the time to come and, and just present to us. It sounds like there are a lot of resources out there available to individuals with brain injuries and neurodivergence. So I'm grateful that now, even with this presentation that you've just given us, some of our members in our community may have employees, with these issues. And now it's good to know that they're not alone, and that there are others in the same journey with them, and there are resources available to them. And again, it's one thing to have the resources, it's another to be able to utilize it.
Yes, and there are many support groups, right? We've got a lot of online support groups and in-person support groups throughout the state of Nebraska that you can get involved in as well. There's 3 different ones just here in the Omaha area that are online. There's one for persons with brain injury, there's one for the family members, and then there's one for those caregivers as well, because oftentimes those moderate to severe injuries, they have caretakers now too. So, and we have ways to connect these individuals to DHHS and to those waiver programs there to assist them so that they can remain at home and still live a meaningful life.
Awesome. Thank you. Thank you so much. That is excellent. We just have a few more minutes left. So I would like to take a moment now to go over some of our upcoming events. For our Gratitude Gala, we have nominations that are open for the MAC 2025 Gratitude Awards. They will be open Monday, January 20th, all the way through July 31st. So if you know of any individuals who is making a great impact in the community, please visit our website at fundmac.org, go to the nominations page, and nominate them for that award. The next event is roll call. We'll have our next roll call on Wednesday, February 12th. It's going to be at Modest Co-working from 5 to 7. So any business owners out there, anyone who's part of the MAC tribe, or anyone who's interested in becoming part of MAC and just wants to learn a little bit more, make sure you come to roll call on Wednesday, February 12th at 5 p.m. at Modest. Also, our MAC Foundation Scholarship applications are open. They are on now until March 30th. So if you know any high school seniors, college students, or anyone who is even in the post-graduate program who can benefit from this scholarship funds, please let them know. Scholarship applications are open and they won't be closed until March 30th. So that is that for me this evening. Oh, one more. Our Pitch Black applications are also open. They've been open since January 2nd. They will be closing on February 7th. Pitch Black is one of our largest events of the year, where the champion gets up to $15,000 seed money to invest in their business. So if you know anybody with a great business idea who would like to take part in this competition, let them know to visit pitchblack.com and submit their application for the Pitch Black competition. Stay tuned with us through our website and social media for updates on these events and other events. Your participation helps us to build a stronger, more vibrant community. Thank you once again, Heather, for sharing your insights and expertise with us today. I'm sure our members will find this information extremely valuable as they look to expand their resources and provide support for their employees. To our audience, thank you for joining us for this Power Hour Business Development Virtual Live Series, proudly presented by Google. We hope you found this discussion as enlightening as and inspiring as we did. We look forward to seeing you next time. If you have any questions, please make sure you contact us, and also make sure you follow us on our social media pages. Thank you so much, and you have a good evening.
Thank you.